The U.S. obesity epidemic is deeply intertwined with the dynamics of free market capitalism. While capitalism has driven innovation, economic growth, and consumer choice, it has also created the conditions that foster widespread, unhealthy lifestyles. Here's how the two connect. 1. Profit motives shape the food supply. In a capitalist economy, companies compete for profits. And in the food industry, this means engineering products are cheap to make, shelf-stable, and hyper-palatable. The result, ultra-processed foods high in sugar, fat, and salt dominate the American diet. These products are not designed to nourish, but to maximize consumption and repeat purchases. Fast food chains, soda companies, and snack manufacturers pour billions into marketing that targets not only adults, but children. In this system, the most profitable foods are often the least healthy. 2. Advertising exploits human psychology. Capitalism incentivizes aggressive advertising. In the U.S., food advertising disproportionately promotes unhealthy foods. These ads exploit evolutionary preferences for calorie-dense food and often manipulate emotions, linking consumption to happiness, identity, or status. Unlike public health campaigns, which have limited budgets and no profit incentive, junk food marketing is relentless and omnipresent, from TV and billboards to social media and sponsorships. 3. Healthcare as a market commodity. In a for-profit healthcare system, prevention is often undervalued. Capitalism doesn't reward long-term health outcomes as much as it rewards treatment of chronic disease. This can create perverse incentives. Obesity-related conditions like diabetes, heart disease, and hypertension generate steady revenue streams for pharmaceutical and medical device industries. Meanwhile, access to preventive care, nutritious food, and safe exercise environments remains uneven, especially for the poor and uninsured. 4. Economic inequality and food deserts. Capitalism without guardrails produces economic inequality, and that affects diet. Low-income communities often lack access to fresh produce and safe places to exercise. Instead, they're saturated with cheap, unhealthy food options. Healthy food is more expensive in terms of time, money, and effort. The market doesn't prioritize equitable access. It prioritizes profitable access. 5. Deregulation and industry influence. Capitalist lobbying efforts often shape policy in ways that undermine public health. Food and beverage corporations have lobbied against regulations on portion sizes, soda taxes, warning labels, and school nutrition standards. They fund research to cast doubt on links between diet and disease, similar to tactics used by the tobacco industry. When government regulation is seen as an impediment to free enterprise, public health becomes collateral damage. To summarize, the U.S. obesity epidemic isn't simply the result of individual choices. It's a predictable outcome of a capitalist system that prioritizes profit over health, volume over nutrition, and marketing over education. While capitalism can be harnessed to serve public health goals through incentives, regulation, and innovation, left unchecked, it creates an environment where the cheapest, easiest, and most heavily marketed foods are also the most harmful.